my name is Jenny Owen and I am a cancer care coordinator for Riverside Surgery in Rock Ferry. My role here is to support the newly diagnosed cancer patients that we receive notification of. A typical day for a cancer care coordinator would be coming through to reception, saying hello to all the teams, finding out what room you're in that day, setting up in your room, being prepared for the day ahead, opening up to all your emails, responding to those of any urgency, and looking what calls that you might have already arranged for those patients who you might already be aware of or perhaps might have already spoken with. On those calls you could be doing a 3-month initial support call, where on that call you will introduce yourself, explain to the patient the reasons for the calling, and basically support the patient in signposting them to services that are available within the community and around their area, and making them aware that there is support available for them. You will also be completing perhaps some cancer care reviews, which helps the surgery and takes that time away from the GPs so that they're able to obviously fulfil their time with appointments. On that cancer care review, you might highlight a lot of support that a particular patient might be needing, and from that you will then make referrals to those support areas. Also contacting perhaps any CNS nurses with any concerns you might have with a particular patient, whether it's any concerns a patient highlights to you or any side effects that they could potentially be having with treatment and struggling with, and you feel that the nurses need to be aware of it for any additional medication support or symptom management they might need. Also within the surgery you've got your practice nurses and GPs to hand, so if you do feel there is any urgency or a particular patient needs reviewing, you can screen message one of the GPs or one of the nurses and explain to them why you feel that patient should be seen that day. Once the patient has been referred to ourselves or myself via the GP, we will make an initial contact, usually by telephone, and in that telephone call we will obviously discuss how they're generally feeling, how they're doing, where they're up to with appointments, but also we will tie in a support letter which we will discuss with the patient to find out whether they're happy to receive this letter firstly. But in this letter it actually details who I am as a person, what my job role does, what it can help with, and has my details of how to contact me, so that the patient doesn't actually have to contact the GP surgery, be call number 30 in the queue, when it could be something, you know, quite simple and easy for me to be able to deal with, or to pass the information that they need on to them. This letter also highlights other clinicians within the surgeries who are at their surgery for support, which is such as the wellbeing practitioners, the health coaches on it, and it also states their job roles within the surgery and how they can help.